Hello, this is Dr. Steve Fortenberry at Dental Care at Memorial Hermann Southwest. One of the questions we get a lot is about dry mouth. It sounds like a trivial complaint, but it's really not when you suffer from it. And a lot of people suffer from it. It can be a side effect of disease, or usually the most common cause is people are on drugs. About half the drugs listed in the physician desk reference have a side effect of xerostomia or dry mouth. And it can have serious consequences when it's a prolonged situation. When the mouth is drier, you don't get the IgE antibodies to kill germs, so people tend to get a lot of decay along the gum line. They're just less comfortable. If they wear dentures, they can't wear them as well. It causes a large number of problems. I remember one of the lecturers I was listening to was talking about how his secretary had to have $50,000 worth of dentistry to correct 20 years of dry mouth and the problems it caused in her mouth. So it's not really trivial. And people that are very smart sometimes come up with solutions that don't work real well. If you're drinking a sugary liquid or a soft drink, or you're putting Tums in your mouth, or alkaloids or cough drops, all those things have sugar in them, and that causes a great deal of decay, especially when you have dry mouth. So that's exactly what you don't want to do. Good things to do are like chewing sugarless gum. Just rinsing your mouth with water as often as you can is great. There's prescription drugs that we use, like fluoride, that don't really make the mouth wetter, but they help prevent the decay that the dry mouth causes. Over the counter, there's what we call saliva substitutes, things like Biotine. It's the one that advertises the most. There's also others like Zerolube and Oralube. You can ask your pharmacist about what they have available. But rinsing with those can keep the mouth more moist and help people be a little bit more comfortable. Unfortunately, if you have a disease like diabetes, not only does the disease make your mouth drier, but the drugs to treat it do also. One of the big things is just to brush and floss more. If it's prescribed by your dentist, use the fluoride, either toothpaste or mouth rinse, to help keep the decay away. Hope that answers some of your questions. Thanks.